So we're going to discuss disc replacement in the neck. A lot of the times patients will come in and ask about having their disc replaced due to ongoing symptoms and not improving without surgery. So what a disc replacement is removing the disc that is causing the symptoms and then replacing the defect with a device, a newer technology that allows the disc to move as natural as possible. In other words, the options prior to a disc replacement consisted of either taking the disc out and fusing it at the same time. Fusion historically works very well, but it does have some long-term problems. This represents a model of the cervical spine. There are 7 vertebrae in the neck region, 1, 2, 3, 4, 5, 6, and 7. What you're seeing is a blood vessel which goes up to the brain. These are the nerves that come out of the spine that go down the arm. This is typically a disc in the spine. So when a disc deteriorates, either you can lose the height of the disc and pinch off the nerve through here, or you can herniate a disc and pinch off the nerve. There are structures on the back of the spine which are also important, and those structures are the joints in the back of the spine, and what they are these little slits that you see here. These can also be symptomatic in causing neck pain. Cervical disc replacement or disc replacement in the neck, it allows the motion that naturally exists on the spine to be preserved while treating the causes of the patient's pain. In other words, if you look at the spine model, what this shows is that the spine continues to move even though there's an artificial implant that's used to replace the disc. So a cervical disc replacement has 2 components, and this is a vertebrae, this is another vertebrae. The disc is in the middle, and you can see by opening it apart, there's 2 components to this disc replacement model. There's a component on one vertebrae and has a dome shaped, and there's another component over here that is metallic with a plastic center, and by putting the 2 components together, it allows the disc replacement to move back and side bending, forward bending, as well as a little bit of rotation. By allowing this motion, it allows you to retain a lot of your motion, but it also prevents the level above or the level below from breaking down in the future.